conversation and discussion on the topic of dementia this morning. Now, fortunately, we have a guest that will actually help us to open up, various areas of dementia that we're probably not aware of. We have Dr. Dokun Adedeji on set in our studio with us this morning. He trained at the prestigious University of Ife, now called Obafemi Awolowo University. In 2002, he won the Global Chairman's Award for Employee Community Involvement in recognition of his efforts as the coordinator of CADAM. Now, he's the Director General of the Christ Against Drug Abuse Ministry, CADAM, a faith-based NGO that caters to the treatment and rehabilitation of drug addicts. Good morning, sir.
Good morning. Thank you very much.
Very wonderful to have you in the studio with us this morning.
Thank you for inviting me.
Now, I know you do a lot of work in the drug abuse space. So I would like you to bring some of your experience as a medical doctor and your experience in that particular field to the conversation of dementia this morning. You know, it's a relevant information that I feel requires a lot of awareness, a lot of, because when people, when someone isn't aware of these things and then they find themselves having to deal with someone with a form of dementia, it's very easy to demonize it as, village people or, whatever the case may be. So let us start from the background. Let's start from a core background. What is dementia?
One of the things we need to first of all correct about dementia, it is not a single disease entity.
Okay.
It's a syndrome of certain situations that present themselves, and then it's a general term used to describe situations in which there's loss of thinking capability, loss of cognitive abilities. So that's why it's not seen as a single disease entity. Is a syndrome encompassing a few
other things. An umbrella of...
Absolutely. That is just the way to say it. For instance, if you then look at it, you see Alzheimer, you see vascular dementia, you see dementia due to Lewy bodies, and then you see frontotemporal dementia. So it's a spectrum of brain disease.
So out of the four that you mentioned, is there like a level? Which one is
the commonest?
Let's talk about how common they are.
Alzheimer is the commonest. It has about, if you find people with dementia, about 50 to 60% of them have Alzheimer's disease. And then the next one is vascular dementia, which occurs because there's blockage of blood vessels in the brain or microscopic leaking of blood vessels in the brain. And also the third one is dementia due to Lewy bodies, and then the last one is frontotemporal dementia. And that is in that direction, the decline. The highest is Alzheimer, followed by vascular dementia, and then dementia from Lewy bodies, and then frontotemporal dementia.
So my co-presenter and I, we were trying to understand, because this is not a field that we're really strong in, right? So we brought up schizophrenia. And one thing that was mentioned is that schizophrenia, something like schizophrenia, is more of a mental health condition than it is a dementia.
Absolutely.
So what strikes this apart? And is dementia a mental health condition?
No. Dementia is not the mental health condition. You see, if you then understand the context of the variety of medical practice, dementia resides in the region of neurology, because of the involvement of nerves in the brain, neurology, and then schizophrenia resides in the realm of psychiatry. Which speaks to presentation in psychosis, psychotic presentation, where people have a complete loss of self in terms of the physical locomotor, not in terms of mental. And when you say mental health is when you look at other things like depression, like schizophrenia, like
maybe ADHD, maybe
absolutely. Like then you go into those kind of but this one is a brain disease. I mean, dementia is a conglomeration of brain condition. So they're different. They're different.
So, but some of the similarities, some of the signs and symptoms you find in schizophrenia, it's possible. So I know you can find depression and anxiety in some forms of dementia.
Dementia, yes.
So is it so someone that is dealing with dementia can have mental health issues, but it doesn't make it a mental health issue?
Absolutely.
Is that what I'm guessing?
It is possible, but you know, then there's a disturbance of clarity. Right. Depending on the one that presents first.
Right.
Because if somebody, for instance, with dementia begins to have something like depression, you ask yourself, is the depression a causative factor in the dementia?
Right.
Because that is one of the causes of dementia. Or is it a standalone? But the significance is that you cannot, because one is principally due to brain condition disease. Demyelination of the covering of the nerve cells is what will lead you to a dementia. Anything that causes you to lose proteinous covering of the nerve. You know, if you look at the nerve, it's like electric cord.
Right.
And also electric cord that you see has also wire covering. In dementia, when those covering, which is proteinous, is taken away by some factors, then there is disconnection, and then the impulse carried is distorted.
Right.
But in the case of also schizophrenia or psychiatric illnesses, is different because it may not be originally in the brain as a brain disease.
Okay.
So psychosis can be induced, and there are different presentations.
Okay. So what kind of situation or circumstances can cause dementia?
For instance, as I said to you, depression can.
Okay.
Also smoking.
Okay.
Alcohol, excessive use of alcohol. And also side effects of certain medications.
Okay.
Right. And vitamin deficiencies can cause it, as well as some thyroid problems. You know, so those are the, as I said to you, anything that causes the removal of proteinous covering of the nerve cells can lead to dementia.
Okay. So I think I understand. Now, taking that into consideration, you know, the removal of the proteinous covering, I understand how alcohol can do that. I understand how smoking can do that. But depression, which is a mental health condition, you know, resulting into dementia, I find that interesting.
You know, the thing is, like the depression, sometimes you find that there's a disequilibrium in the hormones across the brain tissue or something. And if you look at some of, you see, that's why sometimes the depression, then you find that it is when you do clinical history taking, and then when you do laboratory investigation, that will tell you which one is that gives a clarity as to what happened. In depression, for example, we know it's one of the causes of dementia.
Right.
But how that probably will be due to the imbalance of the electronic impulses.
Okay. Now, one of the facts that we saw about dementia this morning is that there is no cure. There hasn't been a certain, you know, a specific cure to dementia. And I'm thinking that it's because of how complex the brain is. And at the end of the day, it is a brain disease. But how can it be managed?
It can be managed medically. Usually, in some cases, yes, there's no cure, but you can reduce the progression. Particularly if, for instance, it's caused by vitamin deficiencies or thyroid problems, you can manage the thyroid problems or the vitamin deficiency, but it's not that it's going to, because it has been established, there's no cure for it, but then you can reduce the progression of it, and then you can manage the patient in the sense that the person can live in almost near normal life.
Right.
So it's just medical management.
Right. Okay. Have you, now, in your experience as a medical doctor and in the space and field that you work in, have you ever had to deal with someone that is dealing with dementia?
Oh yes, absolutely. I mean, as I told you before the program, my mom had a case.
That's why I'm actually asking.
Yes,
so, you know.
My mom had a, but you see, the thing is, because we noticed early, and so we started, my kid brothers and sisters live abroad, and so we discussed this in the family forum, and then we discussed with colleagues abroad, and then we began to put out some just as I said, the hypervitamin and all that, it reduced the progression until she died early this year. We were having conversations, although there'll be phases in which she just closes up to herself and things like that, in which, but she was a mother. She recognized us, and then we could have discussions. There were things she couldn't remember, but the interesting thing, she had very good memory of things, but she couldn't situate them with the immediate or something. So that was a personal thing for me, and the more so because there really more we could do, but we made her life a lot easier. She went to church. She did things that she come visiting, she would travel with us and all. So she led a normal life because we noticed early, we slowed the progression. And so she left the meaningful
I'm really sorry
life.
to hear about the loss of your mother.
Thank you.
Yeah, but I'm getting that early detection is very important.
Oh, it's very important.
For managing dementia.
Absolutely.
Right. Okay, so I want to talk about dieting now. Now, this vitamin deficiency that you've spoken about is quite interesting to me. And then you said in treating your mother, there were some vitamins that she was taking. So let's talk about diet. So obviously smoking is not good. Alcohol is also not good. So what should people not take, and what should they take more of to avoid dementia?
You know, one of the things in dementia or general medical practice is healthy eating habit.
Right.
Reduce a lot of fried things, a lot of sugar. I mean, in the things you take, the spectrum of the food you take, and increase and then reduce the red meat. You know, yes, red meat. When we say red meat, we mean like cow, like this. But if you take things like goat meat or fish or something, that's good. So those are some of the things we need to begin to understand. And it covers the general spectrum, because as long as you live a healthy diet, and you live a healthy, and then a lot of exercise, which we do not normally do. When we say, you know, when you talk to people about exercise, they think what you're saying, go to the gym and be jumping around, and that's not it.
Right.
Brisk walking is a lot of dancing, swimming. Those are exercises that you can get involved in, even particularly at home. You can dance before you have your shower. You can take a walk in the morning. You can take a walk in the evening, brisk walking. And then if you do that regularly, it helps you. And also, one of the things that we also know is engage yourself in cognitive things. I mean, you know, many people are very indolent. They don't read. They don't get engaged in things that bring intellectual.
That was going to be my next question. Like, would there be forms of cognitive exercises? Because at the end of the day, it's a brain disease, right? So would there be forms of exercises that a person can do for their brain to make it maybe, you know?
Yes, in terms of cognitive exercise, I mean, read. That reading is one of it, and also going out and watching things, seeing things, seeing activities, anything that increases your ability to learn. We help your cognitive development. All
right. So as the doctor said, cow pepper soup is not great, and it's also
that's, you know, the thing is, we say in medicine generally, when we're young, we can still do so many things. But the moment you are approaching 40, you need to be very careful about the things you do. You know, for instance, a lot of men eat out of the home because of necessity of work. And then when you go to Mama Put, you know, we pick the wrong meat, but they are the things that are palatable. Our body, all those things, shaki, and then all those red meat, cow. You know, if you also take
it tastes so nice, that's why.
Absolutely. But also chicken. Chicken is very good, but the skin, unless you know, women know how to do, maybe they roast it or something, you take away the lot of cholesterol on the skin. And fish is also very good. But a lot of people think when they call it a quick or something, they think it's only poor people that eat it. But it gives a lot of nutritional benefit.
Protein, isn't it?
You say what?
It's a cleaner form of protein.
Oh, absolutely, absolutely, and bushmeat. Because
good.
And goat meat.
Oh, fantastic.
Yes. You know, because we know this from ordinary experience. If you see a cow, you see cows are not very active. And then they just eat, and then they lodge all the things they eat in the wrong places, which are the things we like.
Interesting.
You know, the hump.
Yeah.
All those kind of places. And then,
yeah.
But if you look at a goat, the goat is lean meat. Is white meat.
Okay.
Fish is white meat.
Okay.
You know, so that is why some of the things. Snail.
Okay.
You know, those are some of the things when we look at the diet that so that's why you look in the spectrum of the management of dementia. It is not only located in the realms of neurology, then it transcends into dietary, it transcends into medical, and then so they can manage all of these things together because they are called the spectrum of medicine.
Yeah. So, okay, I want to talk about risk factors now. I know we've already mentioned some. Cow, red meat being one of those things, right? Now, I want to talk about lifestyle. We've also spoken about smoking. We've also spoken about drinking. Are there any other risk factors? Because one of the facts that we looked at is that dementia is not only common among old people, that younger people can also get dementia, which I find interesting. I've never really known that.
You see, because some of the risk factors that are very clear, genetics.
Yeah. Okay.
Like for someone like me, then I need to begin to check the things that I do, and then I need also to find out when I notice something to say, hey, because it doesn't necessarily follow that I may suffer it, but it puts me at a higher risk of suffering from it because my mom had it.
Right.
So the same thing with age. You know, the thing with age is not, you know, people confuse senility with dementia. They're different. Senility has relation with age. People get then the locomotor centric things begin to decline. That's a different ballgame. But dementia has a situation in the brain as a brain disease because of what we had discussed before. So anything that will affect brain health, you know, one needs to be very, you know, if people also, like I told you in vascular dementia, if you have microscopic bleeding of blood vessels in the brain, it can predispose. And also, if people have any blockage in the blood vessel of the brain, it can predispose to dementia because it means that because blood is not carrying oxygen to the nerve cells will die. Anything that causes damage to the nerve cells will cause.
Okay. Now I want to link it to, and this will probably be my final question. I want to link it to your field, what you do, right? So you work in the drug abuse space.
Yes, I do.
Now, and you know, you just made a point about brain health. Drug abuse and a deterioration of brain health, is there a link? And if given that there is a link, can drug abuse actually lead people to experience dementia early or later on in their life?
You know, probably the area of link is what you meant, because I said to you earlier, one of the dangers you should look for is the side effects of medications. Medications could be medications that are prescribed, but also when you now look in terms of substance abuse, there's a lot of work still going on in the field of dementia. So it hasn't been linked yet with substance abuse. The substance abuse linkage is usually to mental health. Because of the capability of interfering with things like dopamine, that is the cellular protein and hormone, and then the transmission of it. So those are the things, because those ones have effect. The substance that people abuse have effect directly on the brain stem, the brain itself, and then the spinal cord and the brain system, like that. So that is why you see when people do drugs, abuse drugs, they can be psychotic. Depending, particularly, we know the great association with marijuana. Because of the capability of the cannabis, it has the THC component of the cannabis has effect on brain tissue, but not in the realm of dementia. So that's why you can have schizophrenia in them, and you can have bipolar in them, or some people have it predisposing them to substance abuse.
Interesting. All right, thank you very much for joining us.
My pleasure, it is.
I've learned a lot. You know, one thing I really learned is the dieting. I never knew that a diet can actually affect, for instance, brain health that can lead to dementia. So thank you very much. You know, just to wrap up, that is your camera. I would like you to encourage people out there who may be dealing with dementia, or you know, whatever the case may be, or people that don't even know about, you know, why we're having this kind conversation. Just encourage them. And
you know, people must begin people must begin to understand that because of the level of medical practice now, a lot of awareness is thrown on the things that were related to, oh, maybe it's spirit, maybe it's one juju man. Maybe those things are not real. The thing is, let us begin to be observant of our own activities and people close by us, and this is where programs like this help us, so that it opens our mind to possibility. It doesn't mean that if somebody is slow or something, it means he has dementia, but you can check, and then if we can't get in clinical, and then you can do some imaging, and then you know. And then it can help us, and then it helps when you know early. Prevention is usually better and cheaper than cure. And in dementia, you don't have a cure.
As the doctor said, prevention is most definitely better, you know, than treatment, because there's no cure.
There's no cure in dementia.
Thank you very much, Dr.
My pleasure,
for joining us.
Thank you.
That is the conversation on dementia on Tea or Coffee this morning.